Thank you for waiting and welcome to Avestria's Women's Health webinar series. We're so excited today to feature Joanna Strober, who is the CEO and founder of Midi, who is one of Avestria's portfolio companies. These webinars are meant to give you a closer look at all these entrepreneurs that we have in our portfolio, what they're doing, how they're helping women's health, and also to tell you a little bit about Avestria as well. To that end, we're going to start with just a few minutes about Avestria, who we are, who's on the team. We will then transition to Joanna, give her a spotlight to present, and there'll also be a chance for Q&A. So if you see the box on your bottom of your screen that says Q&A, if you write questions in the chat, we can answer them at the end of Joanna's presentation. And then for those of you who want to stick around after we finish the Q&A with Joanna, we're going to talk a little bit more about Avestria, what we do, sort of how we got involved in this, all of that, some of the people on our team beyond Joanna and the people we're proud to work with. So with that in mind, I'm going to hand it over to Linda and Tracy to start the introduction into Avestria, and we'll get right to it.
Welcome, everyone. We're really lucky to have Joanna speak to us. She's one of the superstars in our portfolio. For those of you who are new to Avestria, we're based in San Francisco. We were founded in 2019. We've all known each other for decades, and our backgrounds are really as healthcare operators and investors with extensive industry networks. I'm Linda Grube. And Tracy Dooley, my partner, actually went to Stanford Medical School. So whereas I have a finance and investing background, Tracy actually has clinical background. Tracy and Ava is our director of marketing. Michelle is our legal counsel. Next slide, please. So in terms of what does Avestria do? We're a venture capital firm that focuses on early stage, meaning seed and Series A investments in women's health. And it's important to understand that our definition of women's health are conditions that affect women exclusively. So those are things like reproductive health, menopause, but also conditions that impact women disproportionately, things like Alzheimer's and neurodegenerative disease, autoimmune disease, and then conditions that affect women differently. So that would be cardiovascular disease and many of the types of oncology. In terms of the subsectors that we invest in within life sciences, we invest in devices, diagnostics, digital health, life science tools, services, and therapeutics. We do not invest in direct-to-consumer health. Next slide, Tracy can tell you a bit about why we felt really compelled to start Avestria and why we feel like now is the key time to be focused on it.
So women's health is obviously a really important issue to us. And I think that there's encouragingly been a lot of lay press about it more recently in the recent years. However, I think that there are a number of tailwinds that are important to acknowledge. So obviously, from a scientific perspective, we know that there are biological differences between men and women at the cellular level. However, it wasn't until 1993 that the FDA began to allow women to participate in clinical trials. So from a policy standpoint, as well as from a scientific standpoint, and then also from a legislative standpoint and from a public market standpoint, and the spin out of large women's health strategics, we feel like all these factors are deploying more capital and more encouragement towards innovation in the women's health space. And we really believe that there's a real and growing recognition of that need. And to illustrate a little bit of this, the market opportunity in women's health, you can see that the capital deployment has been somewhat sparse prior to 2021. And in 2021, it did break the $1 billion barrier. However, in the context of a $4 trillion plus healthcare market in the US, there's a lot of room for this to grow. And we're excited to see and invest in the innovation that's to come. So I'd like to turn it back over to Linda to introduce Joanna, who's going to give you a deep dive into Midi.
So Joanna Strober is the founder of Midi Health, a virtual care platform for women in perimenopause and menopause. Prior to Midi, Joanna founded Curbo, the first digital therapeutic for childhood obesity, which was scaled to help tens of thousands of children worldwide. The company was successfully sold to Weight Watchers in 2018. This year, Joanna was named to the Forbes 50 over 50 list of top innovators. And I want to point out that in an incredibly difficult year for fundraising for startups, Joanna and Midi just recently successfully closed an oversubscribed 25 million Series A round led by GV, and that's the fund formerly known as Google Ventures. So we're really excited about everything Joanna's doing and all of her success to date, and we welcome her to talk to you about what she's been up to.
Great. Hi. Well, I'm really lucky to be funded by people like Avestria who understand women's health and understand the really enormous opportunity that we see in serving this population. And menopause is hot. As you can tell, all of a sudden the world is talking about menopause. You would think until about a year and a half ago, it didn't exist. But now the whole world seems to be talking about menopause, which is exciting. I'm going to share my screen and, where'd it go? Hold on. And give a quick presentation. And then I just want to take questions. But sorry, my deck disappeared. 1 second. Here we go. Okay. Share screen. Okay, can you see this? Great. Okay, so menopause is hot, but what we are really doing is not being a menopause company. We are a midlife care company, and our goal at Midi is to transform healthcare for women in midlife. And we've developed a platform that's designed by experts, scaled through technology, delivered with compassion, and covered by insurance. So you got a little bit of the data already from the folks at Avestria, but this is a health equity issue. Women in midlife are truly misdiagnosed, untreated, and underserved. Across the country, only 50% of the counties have an OBGYN. So think about that. There's also a massive shortage of PCPs. So often, if you're looking for an OBGYN or a primary care specialist, there's often a 9 to 12 month waiting list in order to get in. Only 10% of OBGYNs have any training in menopause. And there's this organization called the National Association for Menopause Specialists. They only have 730 people that have gone through their training. So that's for all 57 million women in this country that need this type of care. And the truth is that most doctors are uncomfortable talking about menopause. So we have this situation where this really big population of women, and they really don't have anywhere to go who understand them. There's also a huge impact here. And we're talking about employers, but it's really an impact on people's life. Women are getting derailed. In a very large study, 99% of women said that their menopause symptoms had negatively impacted their careers. 59% took time off due to those symptoms. 50% said they were less likely to apply for a promotion. And 25% said that they would consider leaving their jobs because of these menopause symptoms. 10% actually do. So this really is an issue of equity in addition to an issue of health. And honestly, it's expensive for employers and for payers. The research shows that in a study of 500,000 claims, there was an average additional medical cost of $2,000 per woman because women were not getting the right care. What this really meant is they were poly shopping. They're going to a sleep doctor, and then they're going to a therapist, and then they're going to see someone else for medication, and they need it all in one place. And they need to start with someone who's an educated provider of women's health care. So what we have done at Midi is created a comprehensive evidence-based virtual care clinic, and all of our protocols are designed by experts. We have holistic care plans on everything that includes hormonal and non-hormonal medications, supplements, lifestyle coaching. And it's designed for all the ways that women arrive in menopause: perimenopause, surgical, cancer care. We have a survivorship clinic, all the different pathways. And then important, everything is paid for by insurance. I can tell you, when I was going through this, it took me about a year to find the right person. I had to pay $1,000 to go to a special hormone provider in San Francisco. That's not a scalable solution for most women out there, but it was the only way that I could get the appropriate care. So fundamentally, our approach is to have all care covered by insurance so that women can get access to the best expertise and not have to go bankrupt trying to get it. We started with Midi University, and we went out and we basically decided the most important thing we could do was to scale multidisciplinary expert care. So we went to the experts and we talked to them about building us our protocols. And we then created a university program that we call Midi University so that we can train all of our nurse practitioners to do this type of care. And right now we have over 100 of them. And every one of them could do bone, brain, sleep, anxiety, depression, obesity, the whole thing in one visit. So you do not have to go to multiple providers in order to get the care that you're looking for. So why are women coming to us? They're coming for a lot of things. The truth is, estrogen depletion, which starts around age 35, impacts your entire body. And when your body starts losing estrogen and it starts going down, that's when all of these things start happening. It's why women have more anxiety and depression. It's why our bodies start changing and we start getting these stomachs that make us uncomfortable, even if we haven't changed what we're eating or changed how we're exercising. Our skin and hair start to thin, the skin starts to thin, the hair can start falling out. Trouble sleeping is probably one of the top things. We'll talk about that. So all of these things are affected by estrogen. And basically, because so few doctors are trained in this, they don't understand that when women come to them with all these different things, that you should start thinking about, this is a woman, and what is going on in her body, and how can we treat her appropriately? So if you look at why women are coming to us, the average woman does come to us with 5 symptoms. So you can see there are a lot of different reasons why they're coming. It's not all just hot flashes. A lot of times when you think menopause, you think hot flashes, but I want to leave you, we are not a menopause company. Menopause just means that you've stopped having your period, which starts around age 50. But all these symptoms, they start 35, 40. It's a very long process of care that's required. And then, but it is true that the number one thing is hot flashes and night sweats. But, that night sweats and trouble sleeping impacts every one of these other things, right? So when you stop sleeping, you're also then probably overeating and you're feeling anxious and it is all very interconnected, which is how we think about the care that we give. And it really works. Our outcomes are pretty remarkable. 95% of the patients say that they're feeling better. We really are able within a very short period of time to help them to feel better. I thought I would show you this quick video.
Meet Midi, the virtual care clinic for women 40 plus, designed by experts in perimenopause and menopause. With 4 easy steps, patients can book their visit with a Midi clinician. Patients can self-schedule their virtual visit from there. At their first visit, patients discuss their symptoms, concerns, and health history in depth with a nurse practitioner who's received intensive training from nationally recognized menopause experts. The patient receives a personalized care plan. Their solutions may include hormonal or non-hormonal medications, supplements, and lifestyle coaching. Midi's tech-enabled compassionate care drives strong patient satisfaction. Our patients feel heard, and then they feel better with Midi Health.
So it's pretty simple. Oops, sorry, hold on. Let's see. Okay, so that's how it works. It's really simple. And the most important thing is that it's all covered by insurance. So people can come to us for multiple visits and get the care that they need. And it is very exciting. And, just as an FYI, we're growing really quickly. We're seeing over 2,000 patients a week right now. And a year ago, we were seeing 60. So just to give you some comparison, and we are growing really fast. We're also doing it both direct to consumer and also through partnering with health systems and employers. So we have a variety of ways that people are sending patients to us. Questions?
Wow, thank you, Joanna. That's fantastic. So I'm Ava, for those of you who didn't catch the beginning of the presentation. I'm Avestria's Director of Marketing, and I'm going to kind of be leading this Q&A. Again, if you have questions, please put them in the Q&A box. It looks like we've got some coming in already. But Joanna, I want to start off with the fact that you said it's like menopause wasn't in existence a few years ago, and now you've closed a $25 million round led by Google Ventures. What do you think led to that change and, led to that funding? Do you think it was just more women talking about it? Do you think it was more innovation? Do you think it was just women getting fed up? Do you think it was a combination?
So I'm going to take, I need to separate those two questions, right? One of them is funding and one is why people are paying attention to menopause. I think women are finally starting, and this is completely aligned with Avestria's thesis. I think women are finally starting to say, we need better care, right? Like they're finally looking and saying, we have not been receiving the appropriate care. We haven't been treated for our symptoms. People have ignored us, and we just have not gotten the care that we need. And so finally women are saying, I want expertise, and they're looking, right? And so that is fundamentally what I think the big change is. And now, with research funding that's going on, like there's a lot of, finally people are paying attention to the fact that women have been undertreated for so long. There is also this, and we could talk about this for hours, this Women's Health Initiative study that happened that has been debunked, 100% debunked. There's an amazing article that just came out about it this week that basically scared women from getting the right care that they need. And so that's another reason why I think women are starting to get treatment, is they're realizing that the research was just wrong that was out there. Honestly, I'm actually writing an op-ed on this right now, because you do need research, but the research also has to be well interpreted. And so it doesn't help to have research if you don't interpret it the right way. But the funding was honestly just because we're growing so quickly. So the funding is, people are realizing there's a market, but the way to get funding is just to grow and to have patients. And we have a lot of patients, and we have a really good business model. So the reason we're growing is because we have a really good business model. It's really profitable. We have insurance coverage, and we are growing. So that's the reason we got funded, not because of whether menopause is hot or not.
That's the good distinction. And also, we will be putting this video online. So when your op-ed comes out, we can put a link to it in the about video box. So someone asked a related question, which was, what is the hardest part about growing, especially since you're growing so fast?
Okay. I know the person who wrote this question. We have 120 providers. We are hiring more of them. We need to scale a really complicated workforce and make sure that we have this incredible high standard for care. And we got to make sure that for every one of them that we train them and we make sure that they provide the right care. And so that is the challenge. And we're learning how to do it, but the demand is enormous. So it's really about the most efficient way to grow and train and supervise our workforce.
Okay, thank you.
And then next question, Ariella, if you'd like and you want to have a discussion, I can show you our Slack channel. So Dr. Mindy Goldman, who is really well known to Avestria, has created all of our survivorship, protocols, plus our complex care protocols. And the way that we're doing this is that we have specialists online on Slack. So basically, when there's complicated care cases that come in like this, we have a complex care channel, and people can log in and they can ask their questions. And then we also have weekly drop-ins with Dr. Goldman so that people can also make sure that their patients are getting the highest quality care. So we have NPs who do the care, but we have specialists online, and that's how we're scaling this expertise, is by the way we're scaling the expertise is by having specialists. So the blood clot's a big one that comes in all the time. I read it and I read all about that. I don't remember what their answers are, but that is the type of thing that we have specialists online for. And that's a really key component of how we're scaling expert care. Someone asked, when did Midi start and how many women has Midi seen? We started offering care in September 2022. We're currently seeing over 2,000 patients a week. And so I think it's about 20,000 patients so far. I have to get that exact number, 20 to 30,000 patients that we've seen so far. And then if a patient needs prescription medicine, does the nurse prescribe? They absolutely prescribe. That is what we do. We prescribe medications. So we have 4 types of care plans. We have prescription hormones. We have prescription non-hormones. We have supplements, and we have lifestyle. And every one of the visits has all of those things incorporated in them. So getting back to Midi University, that's what we train our providers on. And that's how we think about our care. Now, one thing I'll tell you as a FYI that I find super interesting is that my most unhappy patients are the ones who don't get a prescription. So it turns out that it's really important that people feel like they're getting some sort of prescription when they leave. They're not always eligible for hormones, so then we might prescribe a supplement or something else, but we have found that people are coming to us for not for lifestyle, but for a prescription medication, and that is really what we do.
And then Joanna, on that sort of conversational thread, what about things like osteoporosis and weight loss? Do Midi's prescriptions cover those conditions as well? Because those are huge, I think, for women in midlife, approaching midlife.
We prescribe a lot of weight loss medications to people who are eligible for them. We have trained our entire team in weight and all the options for weight. So we have lifestyle, we have supplements, and we have prescription medications that we do offer for people with weight issues, and then the same thing for bones. And so if you have bone issues, we can prescribe medications and lifestyle things as well. So for every one of the the issues that we have basically care protocols and care plans that we can offer people. So that is that's really what we're about, is making sure that we provide super high quality care. Someone asked about developing a similar program for PCOS. Yes, the answer is yes. We are training our providers in PCOS, and that is something that we have created a protocol for. So we will have more of that. We haven't started marketing that, honestly, because it's a little early in our development process, but we do have that as well.
Sorry to interrupt, but for those of you who aren't familiar, PCOS is polycystic ovarian syndrome, and it's a condition that affects women, affects fertility, affects their health, and has all these side effects that we're still learning about too. Just as Joanna mentioned, women's health research has been so underfunded. So just wanted to sidebar with that.
There was a question about, do lifestyle medications include antidepressants? I want to talk about antidepressants for 1 minute. When women stopped getting prescribed hormones in 2002, the percentage of women went up 6x who were taking antidepressants. And that's because hormones are very tightly connected to anxiety and depression. And there was not the right, when women were not getting the hormones, they were taking a lot more antidepressants. We absolutely do prescribe antidepressants for 2 things. First of all, SSRIs actually can treat, low doses of SSRIs can treat hot flashes. And so that is one solution. But if people, we can prescribe whatever is appropriate. But we've also found that for many women, if they start taking hormones, they don't actually need the antidepressants. And so it is but again, I'm not the doctor, so I'm just giving you the different types of things that we do. But all of our providers are trained in all of these things. So someone asked, what is the most rewarding and challenging aspect of being the founder of Midi? So in Palo Alto, we have this dish walk, and I call it walking the dish, and I probably do it a few times a week. And at this point, pretty much every time I go on a dish walk, someone comes and gives me a hug and says, thank you for taking care of them. And they say that we have saved their marriage. They say that they are sleeping again. They say they are able to do well at work again. I just cannot tell you how incredibly rewarding it is. Over Thanksgiving, my kids were at home visiting, and we were walking, and this car pulled over, and she's like, your mom is famous. She's saving the women of Palo Alto. It's just really funny. So it's become a bit of a joke in my family about that we're bringing sex lives back to women in Palo Alto. But it's just incredibly exciting and rewarding to be able to offer this type of care and to help women to be able to feel better.
I'm getting a few questions individually, and one actually piggybacks on that one. And so people are coming to you and coming to Midi to get this care, but because their primary care physicians or other healthcare providers cannot necessarily deliver this care. So what training do you think primary care physicians need to receive, and what are they currently receiving in order to meet these needs of women approaching midlife? I guess there's a two questions there, kind of what is currently happening, and then what do you think we can change concretely to help most number of women?
Reality is they're not going to get the training because they have to take care of too many different things. This is complicated care that we're offering. And, the answer is every primary care doctor is supposed to see patients in 10 minutes. And they don't have the time to do this. And so, we have this entire algorithm and this entire system, and we have all this stuff built out for them to enable our providers to have this kind of expertise. It's really hard to have that kind of expertise, and it's really can't even be expected that most doctors can do it. So I don't have a good answer for that, but I see how complicated this care is, and it's very hard for anyone to know all of it. And so if you go to your primary care doctor, they're thinking about so many different things. It's just hard for me to imagine that they are going to also be able to do all of this. We have our visits structured to be a half hour each, right? And so you can have this long conversation with the patients, and it takes that long to figure these things out. And our system for primary care is set up for 10-minute visits. And that is, they have to see 40 patients a day. The nurse practitioners who come to us are seeing 40 patients a day. So in that time, it's really hard when you're sitting there to really get in depth about these issues. So I'm certainly not optimistic that primary care providers are going to solve this. We need experts who are trained specifically in this to provide this type of care.
And the infrastructure, as you said, for 30-minute visit rather than a 10-minute visit.
Right. That's right. So it's someone asked, what is our partnerships? What is our approach to partnerships with healthcare systems? So this is actually a really good question, and it's actually really exciting what we're seeing. So I call it the box problem, which is not exactly there's no other way to describe it for me, which is basically that healthcare systems only have so many boxes, right? And they need to make X amount of money in that box per day. And this kind of care does not make them that much money. So they don't want to build more boxes to provide this type of care. But that being said, they do want a relationship with these women because these women are directing a lot of dollars to those healthcare systems. So what we have found is we can do a deal with a partnership with a healthcare system where we integrate our technology so we can provide comprehensive care with them. We can train their physicians, their primary care physicians, to refer patients to Midi. We make sure those women are getting mammograms and colonoscopies and ultrasounds with the healthcare system. So therefore, we're sending a lot of work to these healthcare systems. And we're sending a lot of business to the healthcare systems, and they are referring patients to us. And so it's basically, we can be their virtual care clinic and provide this care to their population without them having to open another box. And so next year, we should have, we're launching 5 really big partnerships. We launched a few this year. We signed a deal with UCSF. We signed a deal with Memorial Hermann. We should have USC in the next few weeks. But then there's also a few really other big ones throughout the country that we should have next year. So the goal really is to to become the national menopause / midlife care provider and do that in cooperation with healthcare systems around the country.
We also got a related question, which is in how many states is Midi covered by insurance, and what are your plans for expansion?
We are covered in 16 states with insurance coverage, and we're working on expanding that. The great thing is with a employer, we can offer national care. So we have 2 really big employers that are starting in January. And with them, we are now licensed in all 50 states. So when we work with an employer, we can offer care in all 50 states. But for consumers, we are only currently in 16 states. And hopefully we'll be in a lot more by the end of the year. But honestly, that covers about 60 to 70% of the population in those big states. Someone asked about how we integrate patient data with the healthcare systems. We're on Athena, and so we can share all information with them. So if you have a primary care provider and you went to go get care from that primary care provider, you can then, all that information is there and we share it. And the same thing with our visits are shared with your provider. So it can be completely integrated care. This is a really important part of our solution, is you don't have to get this care outside of the system. Instead, it can be part of the system.
Someone mentioned, they said that you talked about a large women's health study that was misrepresented. And she asked, is that the nurses study, and how was it misrepresented?
So it's called the Women's Health Initiative. I could probably talk about that for a very long time, and it is a complicated study, but essentially there was a study that made women, that was announced in 2002, that said that that taking hormones gave women cancer. It's not true, period. Like, it actually shows that estrogen is cancer preventive, not cancer causing. If you have breast cancer, you should not take hormones, which means that for the women in our program, we insist that they have a mammogram every year before we continue to prescribe them hormones. But there is zero indication that a history of breast cancer in your family, or that is a reason not to take hormones, nor is there a reason that that estrogen is now shown to be preventive of breast cancer. But people don't understand that. And so we have all sorts of women who literally come to us and say, my mother-in-law had breast cancer, so I think I can't take hormones. And it's because it's so ingrained in our culture that somehow these hormones cause breast cancer. And so it's just misrepresented. And this big report just came out saying, like, this is the worst thing that has been done to women in the past 20 years, that this entire generation of women were denied the one thing that can keep them healthy. If you look at estrogen, it keeps your bones healthy. It keeps your brain healthy. There's really good evidence starting to emerge that it actually is, that it's Alzheimer's preventive. Like, there are so many good things that come from estrogen. And this entire 20 years of women have been deprived of this because of a misrepresented study. So that is really upsetting, and a lot of doctors are talking about it, and it's definitely something that we need to address. Sally asked very nicely how you can support us, which I appreciate immensely. We are growing, which is super exciting. If you know of employers who would like to work with us, the big thing we do with employers is we can set up national insurance plans with them, so then we can get all of their employers in all the different states to be able to have access to us, instead of only having to do it in the states that we're in. So working with employers is something that is important to us. If you refer women to us, really, we are trying to grow. And if we are growing fast, but learning how to do this. I can't tell you we've nailed all of it, but we're learning how to grow a national healthcare system and a national healthcare practice, and that is an exciting adventure. But I think we're on track to serve, certainly we're going to be serving hundreds of thousands of women very soon, which is very exciting to us.
And Joanna, obviously you're focused on women's midlife health, and you are an entrepreneur, you're in the space. What about the average layperson? Like, what can they do to support women's health in general, be it midlife health, menopause, whatever it is? I like asking this question of all the panelists just because I feel like we get some really incredible, actionable answers. So when it comes to women's health in general, how do you think the average person can support research and development and innovation and improvement?
I don't know that I'm not sure that I'm the person to answer that question. I certainly, I suggest education first and foremost. One thing that, I will say, when I stopped sleeping, when I was around 47, I was still having my period, right? So menopause means that your period is over. No one was talking about perimenopause, right? And so perimenopause is the period of time that I mentioned earlier that starts in your 30s when estrogen starts going down. And as estrogen starts going down, all these crazy things start happening to your body. But no one was talking about perimenopause. I didn't even know what that word was, and I'm a pretty educated person, right? So when I started looking for sleep solutions and I went to my primary care physician, and the primary care physician said, well, if you're really struggling, I can give you sleeping pills, but you can't take them very often. But if you really need them, you can take them once in a while so you can get some sleep. And then they suggested I got a sleep study, and I spent a $10,000 a night sleep study at Stanford. Think about that, a sleep study. They charged $10,000 to my insurance company for, because I had stopped sleeping, when all this was perimenopause. And as soon as I found the right doctor and I got on hormones, a week later, I was sleeping. So that lack of education is so prevalent and so sad that so many women like me are not told, well, actually, this could be related to your hormones, because they don't look at you as a woman first when you go to that doctor. Instead, they have this checklist that is like educated by men. And that checklist doesn't say, oh, think about it. Could this be hormone related? So for me, a lot of this starts in education, and it starts with telling women that and it's why on our website, we used to actually really say specifically, if you are in this age category, these issues could be hormone related, and therefore you should think about getting the right care. And so that is my biggest learning, is that without education, you don't get the right care. So we have to educate the women to look for the right care, and you need to educate providers on what the right solutions are. So it is two sides of this. But to me, that is the most interesting and challenging part, is making sure that people know to ask the right questions, and then that you have providers who are trained to offer the right care.
Yeah, I think that's an incredible answer, and it is a huge challenge. I think we have time for one or two more questions. So speaking of challenges, someone asked, can you talk a bit about how you got started with Midi and your greatest challenges?
So it really came from realizing that this was a really big problem that was unsolved, and that the COVID laws had changed the opportunity. So the reason this is such a big business opportunity is because of COVID, actually, because prior to COVID, you would not be able to start a company to do it like this, right? Getting back to what I said earlier, the business model for primary care is such you have, in order to make money and support your office and support a business, you have to do 40 visits a day. And this type of care cannot be done with 40 visits a day. You need time. And so the way things have evolved is you have concierge specialists who charge $1,000, and they take care of women in their offices, and they have these conversations, and they get the hormone testing, and they have the expertise. And then no one else gets access to this quality care because you can't afford to offer it in a scalable manner. But because of COVID, the insurance laws now enable us to create a virtual company that can provide this care, get insurance coverage, and still create a really good business, but without having to have the in-person footprint. And the way we're doing it is by licensing our providers in multiple states. So we basically we have nurse practitioners who are licensed in all the different states that we provide care, so we can scale them across and make them efficient, and we can make it a good business model, which you wouldn't have been able to do before the COVID laws had changed. So it was really that understanding that you could do this that really enabled us to start the business in the first place. And then, you know, the hardest challenge is, look, this is still this is an operational company. We are a healthcare services company. We still have to figure out how to make a healthcare services company extremely profitable. We're not software, right? We're not going to have margins of software. So we have to get really good at managing a pretty large professional services organization. And that's a challenge.
And then
Joanna, thank you so much for talking with us today. I think, you know, at Avestria, we really have the privilege to work with entrepreneurs like Joanna. And I think you can all see how exciting the work she's doing is and how incredibly important. I mean, we started Avestria to make money for our investors, but, you know, all of our entrepreneurs are changing the world for better every single day and making money while doing it. So, Joanna, thank you for the work you're doing.
Yeah, thank you. This was really fun. Thank you for inviting me today.
Yeah, and thank
And
you
for
to all who
anyone
asked questions.